Hello, everyone. My name is Dr. Yonit Arthur. I'm an audiologist and strength coach, and you are on The Steady Coach. Today, I am so privileged to bring you this interview with Daniel Lyman. Daniel is a mentor of mine, and he is also the founder and executive director of the Mind-Body Therapy Center. Daniel is extremely experienced in treating people with chronic pain and chronic dizziness and other unexplained mind-body symptoms. And he has been doing this for over 10 years. So you're going to be learning a lot from him today. Daniel is a clinical social worker, a psychotherapist, and also works as a mental health coach. And in this interview, we dive into emotions. We dive into how these symptoms come about and how therapy and other methods can help people get better from them. You're going to hear some specifics today on specific symptoms as well. And we dive into both triple PD and MdDS in this video specifically. So please enjoy it, and thank you so much for tuning in. Okay, Daniel, we're live. Thank you so much for agreeing to do this with me. I feel like this has been a long time coming.
I'm excited to be here. This is great. This is fun.
Yeah.
As I was just saying to you before we started recording, I'm impressed and inspired by your work. So I'm honored to be a part of
Oh,
this.
well,
So,
thank you. I know that you haven't taken my course on dizziness. I'm assuming that was not something
I
you've had to do.
I have not, so I apologize.
No, no, no.
So,
No, you're not supposed to have taken the course, but you're acknowledged in the course. Your name's in my
oh,
course.
that's very
Yeah,
sweet of you. Oh
your
gosh, that's
name's in
very
my
nice
course
of you.
as someone
So,
who's willing to answer my pesky questions every so often. I'll write,
oh gosh.
I'll shoot off this. Have you seen this? And what does this mean? And you're always so patient in answering my questions. So thank
Oh,
you.
anytime. Happy to do it. So,
All right. Well, so I thought we'd start by just having you just share with my audience a little bit about
mhm.
yourself and what you do.
Yeah. So my name is Daniel Lyman. I'm a licensed clinical social worker. I'm based in Portland, Oregon. And I'm the executive director of the Mind Body Therapy Center. And we are a team of therapists that are kind of scattered throughout the country, working with people and with mind body issues, dizziness being a very common one that we work with. So we have clinicians, as I said, in Oregon, California, Washington, just in New York, Colorado, so kind of all over the place. And
Mhm.
we work with people all over the country. Obviously, we work with people in Florida as well.
Mhm.
So yeah, and I've been a clinician, I've been a therapist working with people with mind body issues for over a decade now. I was one of the founding members of the Pain Psychology Center in Los Angeles when I lived there. So Alan Gordon and I and Derek Sapico and Alex Bloom, there were four of us that started the Pain Psychology Center, which is another group practice focused on helping people with mind body issues. Um, and from there, I did that for a while, and I'm still a clinical supervisor there. But then I also have this group practice that I run as well. So
Mhm. All right. So
yeah.
guys, you are listening to one of the greats in the field. I know you're going to
That's
be humble about
no,
that.
that's absolutely not true. But but I have some experience. I do. I will admit that I have some experience. I've been doing this for a while, so I feel
Mhm.
confident. Greats in the
Yes.
field. That's very generous, you dude. So
Well, the field has grown a lot recently. So you
yes,
just
yes.
by the nature of the fact that the field has grown, that's already kind of putting you at the top of this mountain now of people who are working this way.
The field has grown tremendously within the
Mhm.
last few years. It's been pretty remarkable to see, which is amazing. It's very
Mhm.
cool. So yeah, it was when we started this. I felt like we jokingly said, we're like a few of 40 people in the whole world doing this work,
Mhm.
and that was an exaggeration. There are probably a couple hundred doing it in the whole, but still only a couple hundred. And now it feels like there are a lot more doing this kind of work and have this kind
Mhm.
of understanding, which is great.
It is
So
great. It is great. Although maybe we'll have a chance to touch on this later. It pains me to say there's also more need for us than ever.
yes, yes, that is
Yeah.
very true. Yes,
So again, I'll put a pin in that for later. Hopefully we'll get back
yeah,
around to that. But
definitely.
I was wondering, so before I ask a little bit more about pain and dizziness, because you mentioned
Mhm.
dizziness, which I'm very excited to talk about with you
Of course.
specifically. How did you personally get into this field, working with people with these psychophysiological disorders?
Yeah. So also, I appreciate you using the term psychophysiologic disorders. I bounce
Very
around,
fancy.
I use a whole bunch of different terms. So please stop me if I say the wrong. Just they all kind of come out of my mouth, and I don't think about which one we've been using. So I appreciate you throwing that one out there. I got into this field a little bit incidentally, I should say. Alan Gordon was my very first professor in grad school, and we really hit it off right away. And he gave a lecture about the work that he did, or the work
Mhm.
that he was kind of emerging doing at that point, which was mind body focused work. And I hung out with him after class, and there was somebody else that also hung out with him that was like, "Hey, we should start a center that does this," and that kind of emerged from there. And
Mhm.
to be honest, it wasn't until after I really started paying attention to it from this perspective that I realized, oh, I've dealt with my own chronic stuff before, and I didn't really think of it in that context. Sometimes I would, but sometimes I wouldn't. When I was in my previous career, when I was working in entertainment, which was a lifetime ago for me, I was dealing with really debilitating migraines. So that was kind of an ongoing thing for me, the point where I would, put a pillow over my head for days at a time just because looking at any kind of light was absolutely debilitating. And I remember having
Mhm.
to leave work, and I had an hour and a half drive. I was living in LA, working in Santa Monica, living in Burbank. And so I had an hour and a half drive home, and I had this migraine come on. And I just remember thinking, I'm never going to make it home because it hurts so
Mm.
much to like, just everything hurts. So I just remember pulling over,
Mhm.
laying down and like laying the seat down, putting a blanket over my head and laying there for hours at a time just by the side of the road, just because I
Mm.
couldn't. Anyway. So I've had that. Plus, also when I was uh, at the kind of the height of my athletic career, which is not much to write about, but when I was running a whole lot, I was. It was at a time when I was also very stressed in my life, and I noticed I was developing more pains that I thought were associated with running, but it turns out that's just how they were manifesting at that time.
Mhm.
So
Mhm.
those are kind of my own personal experiences with chronic pain. That said, everybody alive deals with mind body issues, and I say that a lot to people. Everyone who any human on earth is dealing with mind body issues, whether you think you are or not. So I can name a million acute things that I've dealt with. On and off during times of my life when stress or my anxiety's been higher or various things have come up for me psychologically. So
Mhm.
anyway, this is a long answer to your question, so thanks for bearing with me here. But
I love
um,
this answer. I love it. We have
so
no I love people love hearing about
these
personal
stories,
experiences. Yeah.
yeah, totally. And so as once we started the center, and once I really started learning a lot more about mind psychophysiologic disorders, mind body issues, tension
Mhm.
myoneural syndrome, whatever you want to call it,
Mhm.
then I started seeing, oh, this is how my own psychology plays into the way that my body reacts to
Mhm.
things, and really starting to put those links together. And then once you start seeing it in yourself, you see it in everybody else, and you can really see these how strong of a mind body connection everybody has and how it affects their daily life.
Mhm.
So
Yes. Yes.
yeah.
So really even from a your young clinicianhood that I just totally
Mhm.
made that phrase
Yeah,
up. It
I like
was
that term. Yeah.
that I like that too. It was it was it was where your career was taking you, and then you started to see it in yourself as well.
Yeah, I have a background in theater, which is very like that's what my bachelor's was in, and so it's
Mm.
very all about being in your body and learning how to. That's like one really positive thing about a theater education is it's all about like learning to get comfortable with your body and how to respond to uh, your body in various circumstances. And I think that kind of gave me a good foundation to be able to get in touch with. I know it sounds kind of abstract and kind of weird, but to get in touch with what my body was doing and how my body would react to different emotional and physical circumstances. So that foundation kind of led me into mind body stuff. My mother was also a nurse growing up, so I'm heavily influenced by her
Mhm.
awareness of the medical world, but also she was always very into kind of mind body health growing up.
Mhm.
So those kind of things combined kind of put me on this path. So it makes sense that I landed on this path.
Yeah.
And then when we started the Pain Psychology Center, then I just kind of was like, oh, this is my space. It feels really good here,
Mhm.
and it's just kind of been doing it ever since.
Right. Well, but that also implies to me that you've found it to work, that it is actually rewarding, it actually works. So,
Oh yeah,
I know I'm jumping way ahead here, but hey, why
that's
not?
okay.
Um,
Yeah,
so do people actually recover?
yeah, yeah. So I tell people this all the time because I love the work that I do for that reason, because you can watch a dramatic change in
Yeah.
people's lives. I mean, there's still a gentleman, and he'll probably roll his eyes for me mentioning him because I mention him a lot because he's so sweet. He still sends me a Christmas card every year, even though I tell him not to.
Oh.
Because when I first met him, he couldn't use his arms and wrists and everything. And he said, "Well, I just want to be, I don't have a kid yet, but when I want to be able to hold my kid when I have, I know it's
Yeah.
heartbreaking." And we worked together for, I don't know, 4 or 5 months, not even that long of a period, and totally got better, no pain whatsoever, was able to resume typing. He hadn't typed in many years.
Mhm.
And, when he had a kid, he sent me a picture of him like holding his kid, being like, "I wouldn't have been able to do this and without our work and everything." And it's just like,
Oh, that's
and
amazing. I
obviously that's
know.
not dizziness. That's probably not the best example for this crowd, but that's the first one that comes to mind because that was one of a really impactful one earlier on in my career when
Mhm.
I was like, oh, wow, that you can watch people that are having debilitated by symptoms go from a place of debilitation to rehabilitation to being
Mhm.
able to function, high functioning people. I've worked with people with various versions of vertigo that can barely get out of bed because their vertigo is so intense.
Mhm.
And people that, and now they're living their lives and don't even think about it. It doesn't even occur,
Mhm.
they don't even, we talk about it like, oh yeah, yeah, that was in the past. That was something that is not really influencing or affecting my life
Mhm.
in any way now. So to answer your
Amazing.
question, yes, people can absolutely get better. That's why I love this work. It's very different than other kinds of therapy too, because other kinds of therapy, the results are a little bit more intangible. And not that that's a bad thing, but in this kind
Right.
of work,
For
whether it
sure.
be on your side or my side, whatever we're doing, the results are so tangible. People
Mhm.
are feeling so much better and able to do so much more. It's really cool.
Absolutely. Well, and
Yeah.
that's why I think it's so important to have you here on my channel because the gold standard of treatment for triple PD for which is a
Yep.
name
Mhm.
for chronic dizziness, and I'm sure
Yes.
you've
Yeah.
encountered by now since we share
Oh,
clients.
yes. Yes. Mhm.
Or I send clients to you, and sometimes we have mutual clients. Um,
Absolutely.
is CBT. It's
Mhm.
VRT, so vestibular rehab therapy, which is a type of physical therapy, and cognitive behavioral therapy, and or sometimes acceptance and commitment therapy ACT. And both of those types of therapy have wonderful tools in them, but the baseline assumption for
Right.
many therapists using those tools is we're just helping you cope with
Yeah.
these symptoms, which is a great goal, of course,
Right.
but there's no assumption that you can actually overcome the symptoms and not have them anymore. So that's not
Right.
been
It's
your experience.
no, and it's a, I use the word pain, but I don't necessarily mean literally pain. I mean symptom, but it's from an old pain management model where we thought of, oh, this person has this symptom, whether it be dizziness, whether vertigo, whatever the particular symptom is, they can't actually get rid of it. So let's just teach them how to manage it. And that's what ACT is a lot about, and CBT as well. But ACT is
Mhm,
really about knowing that, okay, we've got this difficulty. Let's learn to live
mhm,
with the difficulty, which can be great in other contexts. But in the
mhm,
context of chronic symptoms, it's really disempowering and disheartening for people to hear.
mhm,
And so we don't operate from that model at all because we
mhm.
see change all the time. We see
Right.
change every single day in our clients. So there is the possibility for full recovery.
Right, right, right. And so
Yeah,
again, we draw from some of those techniques. So some of the techniques I'm sure you use, and
of
we'll
course.
dig into this.
Of course.
We
Yep.
we, we use cognitive reframing techniques from
Mhm.
CBT. We use
Mhm.
mindfulness techniques from
Mhm.
ACT. We use acceptance techniques from ACT.
Totally.
But
Totally.
the baseline goal is different, right?
Yes. Yep. Yep.
Yeah.
Absolutely. And yeah, both of those are really, really beneficial modalities, but
Mhm,
they differ a little bit in that uh, we're not starting the process from a place of how do we manage this or how do we treat the individual symptom just like acutely. We're going to find the the foundation of why these symptoms might be showing up, and that's what we're
mhm.
going to repair. And we'll find that when we fix the foundation, we're going to feel a lot better. Same thing with the house is starting to start to get crooked, but if we fix that foundation, that house will be upright, it'll be solid, we don't have to worry about it anymore. So
Yes. Yes.
yeah.
Oh gosh. Oh, that's a great metaphor. I'm sure you've used it on
A handful of times. It's where, my dear friend Christy Weepy has said that this is an industry of people stealing each other's metaphors. So
Oh, I
please
love
steal
stealing
it. It's
metaphors. Yeah.
absolutely, yeah. It
And
helps
some of
people
the
understand. Yeah.
yeah, some of the less successful ones I try to say, "Okay, we're not gonna use that one again."
For every
So
good metaphor I have, I've got 10 unsuccessful ones, so I can
exactly.
relate.
You just gotta try them out, see which ones stick,
Yeah,
right?
exactly. Yeah.
Well, so that makes me I mean, I know I'm jumping around here, but I think
That's
this is
okay.
a great time to ask then. So, okay, so if we're not doing CBT or
Mhm.
ACT or any of those, what are we doing? What are we doing with people?
Yeah, great question. And it is, the first thing I always tell people is like, this is a in my world, we say this is therapy, not a class. Now, you can learn a lot in a class, but in therapy, it's not just we're teaching you things, it's that we have to do some inner
Mhm.
exploration as well.
Mhm.
So we're not just going to learn about this stuff, though learning about it is very important. Don't get me wrong. In
Mhm.
fact, that can be huge. But we want to go deeper than that.
Mhm.
So there are kind of two layers to what we do in our work. And the first layer is what we call psychoeducation, which is just teaching people about um, pain or
Mhm.
symptoms and why they manifest and how your brain is involved in having them manifest,
Mhm.
because it's a lot of things people don't understand because it's not taught. It's rarely even taught in medical schools, though it's increasing
Yeah.
now, fortunately. But so the first part of that is to really understand why your particular symptom might be showing up. So if you are experiencing vertigo, let's just go with that, because I was just talking to a client who speaking about vertigo. But so if you are experiencing vertigo at certain times in your life, what we want to do is understand why that is. We want to dig deeper and understand what is it that might be triggering it. If we can't figure that out, that's okay. How are we responding to vertigo? Because our
Mhm.
response to the symptom also indicates how frequently it might be occurring and how intensely it might be affecting us.
Mhm.
Now, it's easy for me to say, of course, when you're experiencing vertigo, it's a big, how can you function? It's very difficult. But the way we respond to it emotionally and the way we respond to it behaviorally does indicate the amount of success we'll have recovering from it.
Mhm. Mhm.
So that's kind of the topical stuff that we talk about, is the symptom in and of itself, why it's happening, general brain neuroscience understanding of why
Mhm.
it's there. And then beneath that, okay, why is it that our emotional foundation might have some cracks in it at the moment, which we all do. So there's no judgment on anybody. But what is it that we can do in that emotional foundation to help repair that, smooth it over, and make sure that that house is really steady?
Mhm.
So all of us have stuff in our lives that has caused the foundation of our lives to have cracks or to sag in certain parts or to look a
Mhm.
little bit different or less than ideal, because that's how
Mhm.
being human is. We all have
Mhm.
traumas. We all have uh, adverse childhood experiences, if you will, ACEs,
Mhm.
that inform how we behave emotionally in the world. That's
Mhm.
all of us do, and no one has a perfect life where everything's gone
Mhm.
smoothly and their foundation is just as good as it was in day one. No, that's
Mhm.
not how it works for all of us. But so if we kind of look underneath and see, okay, what has informed how we behave emotionally, and how can we correct those things, or how can we sit with those discomforts, those feelings, to process them and therefore feel better about them and
Mhm.
smooth over that foundation, if we're going to continue with the metaphor, then ultimately that's what keeps the symptom, say vertigo, from coming back or from continuing.
Mhm.
That was a
Okay.
long-winded answer here.
I
Sorry.
love these
I'm
answers. They're
I'm verbose.
perfect.
So
I love it. You're you do the talking. I do way too much
okay.
talking on my channel. You do the talking. So, okay, so a couple things then I wanna follow up on about that. So, when you say
Mhm.
emotions, can you go into a little more depth on how emotions might affect our foundation, like what they have to do with this brain response?
Yes, it's complicated. It's not, and I try and find the best ways to do it simply. And this is where other people in this field are actually better than I am. They're good at making it a simple explanation. But from my perspective, feelings are called feelings for that specific reason. They're not called thinkings; they're called feelings because we feel them in our body. So we actually have a physical response to a feeling. So if I'm really sad, for example, I can feel that pit in my stomach. I can feel,
Mhm.
my eyes water. Obviously, I'm having a physical response by crying. I can feel kind of like down and depressed, like my muscles aren't very strong when I'm feeling really sad, for example. So our feelings re- uh, have a direct response in our body, depending on what the feeling is and how we individually manifest our feelings.
Mhm.
Now, uh, what happens over time is if we are conditioned or trained to not feel certain feelings. So we think of a very healthy person: when they're sad, they cry. When they're angry, they express it. When they're happy, they express that. A very
Mhm.
healthy person expresses their feelings in productive ways. And they can feel those feelings, then they feel them and they go away, because that's how feelings work. If we let ourselves feel them, they just
Go
go
up
away.
and they go down.
Yep.
Mhm. Yep.
Exactly. All feelings. No feeling lasts forever. It comes up and it goes down. That's a perfect way of putting it. So, you can, even if you're feeling as happy as all get out, that feeling may last for a minute. It may last for an hour. I don't know, but it will come back down. Same is true for anger, sadness, surprise, what have you. But throughout our lives, what happens is if there are influences on those feelings, we we consciously start to change the way we feel those feelings, and we kind of mess with our system. We say, "Oh, I'm not allowed to feel sadness." For example, like I remember
Mhm.
when I was a kid, I would go see a movie and I'd want to cry, but I remember being like, well, maybe like 9 or 10, and being like, "Oh, but guys don't cry." So I would resist the urge to cry, which was a natural human experience that I was having at that moment. And I would resist that urge. I'd kind of like clench up a little bit and be like, "Nope, I'm not going to cry. I'm going to sit here and be masculine," or whatever I
Mhm.
was thinking. I don't know. I'm not the most masculine man in the world. So I don't know how I was thinking that. But um, uh, so we
But
sit
it's
there and
but we're influenced by these messages, right?
yes, all of us are.
Right, all of
All
us
of us
are.
are.
Mhm.
And they can, those influences can be cultural. So men are not supposed to cry, women are not supposed to be angry. Those are kind of the stereotypes in
Right.
American culture and Western culture, is that a woman who's angry gets called all kinds of terrible names. A man who's sad or cries is weak and not
Mhm.
masculine enough. So there's these
Right.
all these things. So what happens is we grow up in this space where we're not allowed to just feel our feelings in the healthiest possible way. Now that can also be influenced by our parents as well. Some parents are very uncomfortable with their children feeling certain things or expressing their emotions in certain ways. Some people get super uncomfortable when somebody cries in front of them, so they tell them, "Don't cry, stop it, it's okay, like just stop crying, whatever you do," because they feel really uncomfortable.
Mhm.
So again, this is my long-winded answer, but what happens to those feelings when we resist them, when we actually tell our brain, "Nope, this is not safe," is we put our body into fight or flight. I know you've talked about that in other videos that you've produced here. So
Mhm.
we put our body into a state of discomfort and anxiety. We actually tell our body, "Nope, it's not safe to feel this feeling right now." And
Mhm.
our brain is not very good at distinguishing between a physical threat and an emotional threat. So whether it's somebody chasing us with a knife or us telling our brain, "Nope, you're not allowed to feel these feelings," our brain says, "Danger,
Mhm.
anxiety, danger." And that manifests in our bodies in different ways. So this happens a lot when you see somebody repress their anger, especially with anger, but with all feelings. When they suppress their anger, they start feeling more anxious. You can watch it happen. They start feeling more agitated, and they don't allow themselves to feel the anger, but feel more fearful, or more jittery, or more, their breathing gets more shallow. So
Mhm.
the suppression and repression of our feelings has a direct response in our bodies that we can see very, very clearly. Now, what happens is sometimes those messages kind of get haywire and go haywire. And based upon when we experience some sort of pain event or symptom event, those can be connected to those emotional moments when we suppress or repress emotions.
Mhm.
So, vertigo, for example, let's say your spouse is potentially verbally abusive in a way to you, and it's very threatening to you, and you are very angry with your spouse, but instead of feeling that anger, we just feel anxiety. Now this is taken from an example that I worked with years ago, but this person would then uh, would experience vertigo in those moments instead of actually experiencing the anger that they would feel towards their
Mhm.
spouse for being verbally abusive.
Mhm.
And now it's not always that clean, like that directly linked. We don't always see it that, like, where it's like, "Oh, here's what happened, and then here's the vertigo symptom," so we know exactly it's correlated to
Right.
that, or there's causation.
Right.
It
And I
does
see that
happen.
especially with dizziness, that there's kind of a lag. There can be a latency,
Yep.
like,
Yep.
because again, when we think about fight or flight, diverting blood, it
Yep.
takes that reaction may be instantaneous, but it may take time for the organs in our body to not
Hmm.
work properly or not work optimally, or for
Yep.
our brain to start to misinterpret information coming in from our sensory system. So there's not
Right.
always an immediate I love that example, but I want people to know also they
It's
may
not
not
always like
be
that.
it's not always like that.
No, and when you think about it, if you are in a place of danger, for example, your brain isn't actually going to give you these symptoms,
Mhm.
because executive functioning first, meaning if you are in a place of danger, you need to find safety. And usually, once we find safety, that's when our brain says, "Oh, you can feel
Bingo.
these symptoms." It's the same thing. Like, this is a dramatic thing, but we've all seen war movies where someone's shot in battle, and they're like trying to rescue their friend, and they rescue their
Mhm.
friend, and somehow they're able to run those extra 100 meters even
Mhm.
though they've been shot, and they don't really feel pain. They're just able to get through it. And then once they get to the bunker and they're safe, then they feel all kinds of
Yes.
excruciating pain. That's when the pain kicks in. That's when symptoms show up. So it doesn't have to be pain. I know I use that word a lot, but it could be
Sure.
various symptoms.
Mhm.
So yeah, it's not always that directly correlated. It's oftentimes only when our brain begins to feel safe that actually the symptoms ratchet up, that people will
Mhm.
start to feel dizzy, or yeah, yeah.
Yes. Yes. Okay. So that raises a great question then, and this is one I get asked about a lot.
Uh-huh.
So people say, okay, I buy all this. I buy it. Fine. You're right. I have emotions that I'm not feeling or something is stressing me out.
Yeah.
Okay.
Yeah.
How do people process emotions? What does that mean?
Yeah. So that's a great question. And I wish there was a three-step process that I could
Yeah, I
tell
know,
everybody
right?
there's to process
I was
emotion
I was punting
because
it to you for a reason. 'Cause I
exactly, yeah. It's really simple. You just got to do these three things and then you're good to go for the rest of your life. No, I wish that were the case.
Yeah.
How do we process? I think what happens is people tend to overthink processing feelings. And I use happiness as an example because it's helpful to see that most of the time, most of us let ourselves feel happy.
Mhm.
We just kind of experience happiness, we feel good, and then it fades. Most of the time. There are examples where I can talk about where people that's not the case. But most of us, we allow ourselves to feel happy. We don't get in the way of the happiness. We don't try and think, okay, how do I feel happy here? Let me think about what happiness or joy feels like and really get to the depths of my joy.
Right.
You know, we don't really think that way. We just experience it. And partially that's
Mhm.
because, especially as Americans culturally, like there's an emphasis on happiness, like
Big
be
time.
happy. Yeah. Like you're supposed to be happy. So when we do, we're just like, great, I'm happy. I'm feeling it.
I'm doing
Um,
the right thing. I'm where I'm supposed
yeah,
to be, whatever that means,
exactly.
right?
Exactly.
Yeah.
And if we think about all feelings being equal, meaning all feelings come and go and they have no different weight, they're all just part of being human. Like everybody experiences all feelings because you're alive.
Mhm.
If we think about it from that perspective, then actually what we'd want to do is experience joy, experience sadness, experience anger the same way, all the exact same way, where we just let ourselves feel it. We don't try and overthink it. We just allow ourselves to feel that feeling. Now, the problem is oftentimes people will come to us and be like, well, I've worked with people that, I haven't felt sadness in 20 years because we've done such a good job of suppressing it that it's now repressed, which means we're not even aware of
Mhm.
what we're feeling. Suppressing is when we push it down consciously. Repressing is when it becomes subconscious and we're not even aware of it.
Mhm.
So the way that we do that then is it's honestly a lot easier working with a clinician. Obviously, I'm biased because we're clinicians here, but I think it's a lot easier to help learn to feel your feelings when you're working with somebody else.
Mhm.
But the way that I encourage people to do that outside of working with a clinician is a lot of journaling is very helpful.
Mhm.
There's a lot of like workbooks and tools out there that help people to understand their feelings.
Mhm.
But the number one step you can do is to consciously take judgment off of your feelings. So if you're feeling angry, don't try and get rid of it. Don't, just like the way you would with joy. It's not like you try and get rid of joy and happiness. You don't try and say, "Oh, I got to get this feeling off of me." No, you just sit there and then it goes away. So that's what we want to do with anger and sadness, especially. It's just allow ourselves to feel them. Take the conscious judgment off of it. That's a small step, and that's a kind of a first step, but that can
Mhm.
go a long way over time. It kind
Mhm.
of helps us deprogram. I remember for a while it was really hard for me to cry because I'd done such a good job of programming myself that wasn't masculine enough for me. And over time, I reminded myself, nope, it's healthy to cry. There's a very positive response to something that makes you sad,
Mhm.
and it gets easier and easier over time.
Mhm. So, how about fear? Because that's another one I get asked about a lot,
Hmm.
especially people who are dealing with chronic conditions. There's kind of a trauma in itself, and
Hmm.
they become very, 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 very afraid of their symptoms, especially, which is
Yes.
a completely understandable response. So, how does one
Yes.
process or work through the very real fear that's there?
Good question. And this is, you'll notice that up until now, I haven't mentioned fear
I
as
noticed
feeling
that.
that we want to. Yeah, because the population that you and I work with tends to fear becomes a defense. Fear, what we would say, is an emotional defense. So the same
Yes.
way, like some men just go towards anger when anything arises because that's kind of their defense against a lot of things. Or some women go towards sadness even when they're feeling joy or anger. They just
Mhm.
cry no matter what. It can be kind of a defense against those other feelings.
Mhm.
So again, I'm stereotyping here, but
Sure.
those things can go across all genders and everything. So I'm only using
Sure.
those because those are the kind of general stereotypes.
Sure.
Um, uh, Fear is, as Alan Gordon used to say, fear is the fuel for a lot of chronic pain
Mhm.
because a body and mind in a state of constant fight or flight kind of starts to fall apart.
Mhm.
It's like driving a car at the top of the speed limit,
Mhm.
where it's like, okay, it can do it. Like they showed you on the speedometer that it can go 150 miles an hour.
Mhm.
But if you stay at that speed for long, things are going to start to go wrong.
Mhm.
And that's kind of what happens to our bodies when we're constantly in a state of fight or flight or high
Mhm.
anxiety, you might say. So when it comes to the symptoms and the fear around whatever symptom we have, it's very common, of course, to have this learned terror around, oh crap, the dizziness is coming, whether it be, posturally related, whether it be, you name it. I've heard it related to a million different things. Light related. I've heard all kinds
Right.
of things.
Vision, right. Visual stimuli.
Visual, yes,
Yeah.
exactly. Movement
Yeah.
related, whatever. So whatever it is, we can start to get anxious about. Oh, I have to get in the car later. I have to even stand up from this chair, and I'm so worried about standing up and what that's going to do. So what we have to do is build confidence for ourselves that the symptom we are experiencing has a large part to do with the emotional side of ourselves. When we build confidence in that, then we can become a little bit less afraid that this symptom is ingrained in our brain and we're never going to escape it. That's part of the reason that the therapy is focused on recovery, because if we keep ourselves in a place of, oh, I'm never going to get better, we stay fearful. We stay in fight or flight, and that exacerbates the symptom over and over and over again. So I don't mention fear as a thing that we lean into, because usually people are coming to us, and I know you've experienced this, people are coming to us in high states of fear already. And so we're not trying to teach them how to experience fear. That's a whole nother population that does exist out in the world, but that's not a population that would develop chronic pain. It's just not. People that develop chronic pain tend to be more fearful people, and people in chronic pain tend to be more fearful because of the chronic pain.
Right.
We see these loops over and over and over again. And you may be thinking like, oh, I'm not a fearful person. People are watching. I'm not a fearful person. Well, what happens is that can be a subconscious thing that we're not even really aware of. People that are big planners, or people that, perfectionists, people that look ahead trying to organize everything, there's fear at the root of a lot of that. We don't necessarily see it as that, but from a psychological perspective, that's fear motivating you to behave a certain way. Did I answer your question there?
Definitely. So I'm going to run something by you, because I was asked a question like this recently, and I was kind of trying to think about how I work with this. So what you said, one big piece is this not reassurance, like constant reassurance, but education and understanding and belief that this is something I can overcome, and my body's not broken. So that's kind of the bottom line.
Yes.
But you also said something, you mentioned about fear as a defense, like fear as a reaction to, and I always tell people, I am 100% on board. I'm not at all challenging why you would feel fear about these symptoms. They stink. Of course you would feel fear. They're horrible. Like spinning vertigo. Awful.
It's awful. I've had it. It's terrible.
It's a terrible thing. It's a terrible thing. But I always wonder, what's not just there's a story there behind the fear, and there's a story behind the fear for people. Some people do develop these kinds of symptoms and don't have this response, and some people do. And that tells us that there is something individual about a fear response. So what I'll dig into with people is, first of all, understanding what the real fear is, because it's not usually the fear of the symptom. There's a fear of some kind of story under it, right? Like, if I have the symptom, then I will be disabled. I will never be able to live again. I'm going to let everyone down. And that we go and we follow those down.
Catastrophic thinking, which is classic CBT stuff. Yep.
Right.
Yeah, totally.
But I follow those from like an emotional perspective, like not just, oh, these thoughts are just happening, but where are these thoughts coming from? Where did you learn that not that this could be an issue, obviously, but what does that mean to you? If that is a possibility, oh, I'm going to end up, unfortunately, I hear this from people with dizziness, I'm going to end up in a mental institution because I'm derealized and depersonalized. So I must be going crazy, and they're going to take my kids away. I hear things like that. And I always want to kind of follow that down that road and understand where, like, what that means to that individual person. Obviously, there's no question those things are fear inducing, but what components of this person's past experiences are leading them down that specific road?
Yes, I think you perfectly said, because I was just about to go back to our analogy of this house here.
Right.
Usually it is cracks in the foundation
Bingo.
that will inform how we think about these things later in life. Yes. So because of these cracks or what have you that's causing the foundation to not be steady, that's why we start to go down these rabbit holes of, oh, I'm dizzy now, which means that I'm going to be in a mental institution. I'm going to lose my job. I'm going to get divorced. I'm going to what have you. But it's because of those things and the cracks in the foundation. We want to figure out what are those cracks in the foundation that cause that?
Mhm.
That's causing this
Yes.
kind of thinking. So,
Yes. And so you're saying a big component of repairing that foundation is awareness of what the
yes,
cracks are, and then
absolutely.
trying to understand or feel the emotions that might be missing from our conscious mind, that might also be kinda hanging out down there, creating cracks in
Totally.
the foundation, so to speak.
Yep,
So, what
exactly.
else what else can lead to cracks in the foundation?
This is where I think the people that have done tons of research into the adverse childhood experiences, for those of you watching this, if you don't know about that, Google it, ACE study. It's from through
Oh,
Kaiser.
yeah.
They did it great. It's very, very helpful. It demonstrates that you can actually take a test to see what ACEs you have in your life. Everybody's got,
Mhm,
at least one or two or so. But things like divorced parents or moving a lot as a kid or early deaths of people close to you as a child, or being hospitalized as a kid a lot for medical issues, or those kinds of things all can cause cracks in our foundation because they are things that make us feel less safe in the world.
mhm,
The
mhm,
goal with all of the work we're doing is to feel safer in the world, to feel safer within our bodies, to feel safer within our marriages, our
mhm,
relationships with our friends, our family, just to feel safe in the world.
mhm,
And all of those things as a young kid tell us, you know what, the world isn't quite as safe as you thought it was
mhm.
because
Yep.
oh, parents might get divorced without you even really knowing about it, or
Mm,
somebody could die from a car accident. And that tells us, oh, I can't feel totally relaxed in these relationships because somebody could just disappear like that.
mhm, mhm,
And that's really hard on all of us. That's really tough. And we've all had experiences like that. Everyone alive has had something that has shown them that the world isn't quite as safe as we would expect it to be as a baby that's, really taken care of.
mhm,
Another ace might be that you weren't taken care of as a baby. You weren't, attended to when you were hungry.
mhm,
That again, while you're not fully conscious as a child of these things, it's going to send messages to your brain that, oh, the world, your needs can't be met. Even
mhm,
just being hungry or your diaper not getting changed, your needs can't be met.
mhm.
So all of these things can create cracks in the foundation, which can cause the house of our adult lives to look a little bit funky or to behave in different ways. I say this as I'm sitting in my 130-year-old house that is literally crooked. So maybe that's why this analogy is so apt for me. So, but all of these things influence how we behave and how we feel as adults.
And so can those cracks be patched? I guess there's this assumption again in certain types of therapy that you just have to, again, you can cope with it, you can be aware of it and regulate your nervous system, but that you're just kind of stuck with a crooked house or a bad foundation. So can those things actually be healed in a way?
Well, and so this is where my metaphor is not so great
Mhm,
because I don't. It, everyone has cracks in the foundation.
mhm. Yeah.
Everybody does. So we don't even really want to think about them as bad. We
Mhm.
don't want to think about them as like, oh, this is a bad thing. We should get rid of this because you'd be dead if you didn't have any of those
Right.
cracks. Like, that's just
Right.
being
It's part of the
alive
human
means things are not.
experience. Yeah.
Yes, exactly. Being
Yeah.
human means things are hard sometimes and they're difficult, and it informs how we go through life. But to answer your question, it's not so much that we can fix the cracks, but we can learn how to work with them in a way that we don't really care about them anymore. It's part of the character of the house.
Right.
You know,
Right.
I just made talked about my house. It's literally 130 years old, and I love this house. It is funky and kind of weird because it's crooked, but I love this house so much, and it works great. I don't
Mhm.
think twice about the fact that it's crooked. If you
Right.
put a marble on one end, it rolls to the other end, but I don't think twice about that anymore. And so I don't
Yeah.
necessarily think of it as like, oh, we have to fix the cracks so much as we learn to work with them and learn to just be like, you know what, this is part of who I am, and it's awesome. This
Mhm.
informs who I am. How can I live with this in a way that is empowering and not disempowering?
Right, right.
You know?
So in other words, you can change the way that your brain views. I mean, again, I'm saying the brain, but I
Yeah.
it's the way that your brain is using that old information.
Yes.
Here's my metaphor. You'll have to tell me if you like this one. You can take it if you want it. But it's like if you see a movie in 3D, I don't know if they still
uh
do that nowadays. I'm dating
Oh, I
myself.
love 3D movies,
The
but
3D
yeah.
movies. So you're seeing a movie in 3D and everything's coming at you and it's like a full body experience and your heart's pounding. It's like, wow.
Yeah.
Versus like you read the plot line and like a dry like newspaper column. So
Right.
when we have these powerful or difficult experiences, they both contain the same facts, but one of
Yep.
them is this whole body really disconcerting or disturbing experience. The other one, same facts, can't change the
Right.
facts, but
Right.
the brain's not. not interpreting it the same way. It's just, this is just what
Totally.
happened.
We're not as emotionally involved at that point.
Exactly.
Yeah.
Yeah. So is that what you're
Yeah.
talking about?
Totally. Yeah, if we can get to a place where we can see the cracks in the foundation from a little bit more removed, as
Mhm.
opposed to thinking of them as like, or reacting to them as though something's terribly wrong, then
Mhm.
yeah, we can have a healthier response to them. We can just see them, and be like you're talking about, like read the byline of the movie or read the synopsis
Right.
of the movie and be like, okay, that's it. That's fine. That's no big deal. We can see the cracks and say like, yeah, this is just part of my story, and it informs who I am, but it doesn't define who I am,
Right.
and
But
I'm not disempowered because of it.
right, but what we're saying here, this is also on a subconscious level as well. Because I've
Yes.
heard people say, "Yeah, yeah, my dad was, did this or that when I was a kid, but it's okay. He was an alcoholic. I forgive him. It's no big deal."
Right.
But
Right.
they haven't gone through the process of actually feeling any of the emotions associated with that,
Beautifully said. Yeah,
right? So
exactly.
so then
And
they're
that's
not
really important.
so they haven't they're not authentically uh, integrating this information into their life right now. They've just kind of put it off, and that's the source, you're saying, of a lot of this source
Yes,
the source of a lot of this stress that I call, as I call it, that leads to this fight or flight response and this cycle of pain or
100%.
dizziness.
Because oftentimes when you're in the state of, let's use the kid with the father who's an alcoholic,
Mhm.
of course that's scary when you're a kid, because for someone who is dealing with alcoholism is really up and down.
Right.
They might be like loving and warm to you one minute, the next minute when they're drunk, they might be yelling at you, they might be really intense. But as a kid, you can't have your full, honest emotional expression at that point, because your drunk parent might hurt you,
Right.
verbally, physically, what have you. And so you suppress those feelings, and just
Mhm.
either go in your room, you run away, you just kind of stay steady. So we're not actually feeling all the feelings that are being generated at that
Mhm.
moment. So and that's a survival mechanism. We're doing that because we have to.
Mhm.
But that doesn't mean that the feelings just disappear. They
Right.
stay with us, and it informs how we feel throughout the rest of our lives. So yes, we need to feel those feelings,
Right.
which
Right.
sounds weird, but it's true.
No, no,
We
I
have to go
know.
back.
Feel feelings. I know. I
Yeah.
know. It took me a
Yeah.
little while to come out and say that on my YouTube channel, but I'm out of the closet on that now, to say it now.
Congratulations.
Thank you. Thank you. It was a journey. Um, so yeah, I think people sometimes, maybe due to cultural pressures or what have you, they feel like forgive they forgive prematurely before there's this pressure to forgive and move on and make something good of your life again. And it's lovely to have positive thoughts, but that push to be positive, to be happy, to forgive often means we just got a bunch of stuff that's piled
Mhm.
up beneath us that we're not that's fueling this
Totally.
physical anxiety, right?
Exactly. Exactly. It is the suppression of our, I try to say it as simply as I can here, like the suppression of our feelings, either right in this moment or 20 years ago or 30 years ago when we were younger and had to suppress our feelings around our parents. The suppression of our feelings causes anxiety. And
Mhm,
anxiety has all kinds of physical effects on our body. Even
mhm.
if you're not feeling that anxious
I
feeling,
was gonna
there's still
ask.
anxiety there.
Right.
So
So I'd love to ask you this. I know I'm also just
that's all right.
jumping around. I love it.
Yeah.
Um, I have a significant subset. It's a minority, but it's a significant minority of people who said, "I was never anxious. I was cool as a cucumber
Right.
before I got dizzy."
Right.
So, how do you think about those people?
Yeah, it's a good question. Anxiety manifests in a lot of different ways. Um, there are like kind of the more like classic
Like a thinking
presentations.
anxiety,
Yeah, like a
right?
thinking anxiety, or like you
Mhm,
think of like a Woody Allen kind of anxiety, like a
mhm,
neurotic kind of like
mhm.
talks fast
Twitchy,
and does.
yeah,
Yeah, exactly. Like
yeah.
that's kind of like a classic form of anxiety. There's also the people that are very steady, who are not presenting physical symptoms of anxiety in like the Woody Allen sense, but in the constantly thinking of worst case scenario, kind of what we call
Mhm,
catastrophic thinking in CBT terms. Um, so they're always planning. I have a friend like this who's like, he's the most chill guy, but when it comes to anything, like I was just hanging out with him last weekend, and he was like, "Oh, don't let the dog outside of the house. The dog will get eaten by an elk." I was like, "What? By an elk? That's not gonna happen." First of all, elks don't eat dogs. So, but that's like his first response, is like,
right.
is the worst case scenario is
Mhm.
catastrophic. And that is a manifestation of anxiety. That shows us
And
that our brain,
perfectionism.
yes, totally. And that's perfectionism is another result of anxiety. Our brain doesn't feel safe. So what we try and do is get things just right so that we can feel safer. I've,
Right.
yeah. Does that answer the question there?
That's Beautiful. Because again, it's I've heard people say things like, "But I was so laid back," and then I don't again, they were calm. They're like, "I was so calm and laid
Right.
back. I never had any problems." But again, like you're saying, when we say anxiety, we're not referring to heart palpitations and
Yeah.
sweating and, like, being
Right.
really neurotic.
That can be part of it, but
Right,
that's not all encompassing of
right,
anxiety. Yeah, we're
right.
talking more clinically speaking than more like superficially speaking.
Well, but
So,
that's one of the tricky things because these studies that are done on chronic dizziness, there aren't enough. But one of them I'm thinking of specifically where they looked at whether certain characteristics, certain traits, ca not traits, excuse me, because that would actually be much more interesting to me, but these certain psychiatric preconditions would
yeah,
cause people to develop chronic conditions, and anxiety was one of them, right? So,
right,
but when they give these clinical questionnaires about anxiety, they're asking about, like, outward manifestations of
right.
an anxiety disorder. They're not talking about this kind of stuff.
Totally, totally. And one thing I also wanna make clear though is that you don't have to be an anxious person in any
Mhm,
sense of the thing to develop PPPD or other mind body
mhm,
symptoms. You can have things that happen in your life. You can be cool as a cucumber and then go through something traumatic, and maybe it doesn't even feel that traumatic, and that causes anxiety in your life because
mhm,
you're still human, just like the rest of us. So
right.
even let's say you've got more gray matter in your brain, which is the part of your brain that helps regulate everything. If you've got more gray matter in your brain than Buddhist monks, but you get in a terrible car accident where you almost die, well, that's going to cause a certain amount of anxiety, and your brain
Right,
function is actually going to change based upon that.
right.
So it is that's so even if before you developed these symptoms, you're like, hey, I was totally cool. I'd want to know why they developed and what was going on in your life when they developed. I can't tell you
Right.
how many times people will, and I joke about this, and I mean no offense to anybody, but I joke about this. People will say like, I'll ask them when a symptom happened in their life, and they will say, when the symptom started, nothing was going on. It was totally
Oh,
fine. Life was
yeah,
good. And
it's
then
good.
for us, like 2 or 3 sessions later, they'll be like, my mom died that week. And you're like, what?
Right,
You're
I
like,
know.
oh my
Oh my
gosh,
gosh,
like,
I
that's
know.
trauma.
It's
That's a big
horrible.
deal.
I
Or
know,
or they'll be like,
I know.
a couple weeks earlier, I was in a terrible car accident or something
Mm,
like that. And you're like, well, that's actually, I mean, we don't when we think about manifestations in the body, we don't think about them happening instantaneously from these
right,
kinds of traumas and up and emotional
right,
upsets. It takes a little bit of time for them to manifest, but it happens a lot where people are, doing fine through life, not managing a lot of
right,
psych issues or anything like that, and then something traumatic happens, and that kind of starts them on a path of,
right,
oh, wow, I don't feel like I used to feel. I feel off.
right, right,
So
right, and it could be set off, for example, by some kind of, say, virus in the ear infection. I've seen that happen to
yes,
people, but if it
yes,
catches them at that vulnerable time when
yep,
there's stress right before, stress right after, again,
yes,
right before after maybe a longer time span than a week, but it might be,
right
but if
around
it
then,
catches
yeah.
them at that vulnerable time, it can become chronic even without a long history of anxiety beforehand.
Yes, I see that all the time with inner ear
Yeah.
stuff, actually.
Yeah,
So
yeah, me too. Yeah, yeah, yeah.
yes,
Yeah,
all the time.
just catches
So
them at the right time. Yeah, yeah. So, well,
yeah.
that one sorry, did you want something you wanted to
No, no,
say?
go for
No?
it, go for it.
Well, that made me wanna ask about dizziness specifically. So, I
Yeah,
know you mentioned as someone who's been doing this for a while, I know pain is where your starting point was, but you mentioned you've seen a lot of people with dizziness,
tons. Yeah.
tons of people with dizziness. So, do you see people relatively regularly whose dizziness is a major symptom, if not the primary symptom that they're having?
The short answer is yes, especially if
Mm,
I include the people that I work with and as part of my team.
mhm.
The thing about being a therapist is like our population is relatively small at any given moment because I'm
Sure,
only working with
because
20,
it's
25 people or so, or 30
right,
people, so it's not huge.
right.
But if I look at the whole team, yes, we talk about dizziness all the time as a primary symptom
Mhm, mhm,
of what's coming up for people.
mhm,
Sometimes it's a secondary symptom, and when I say primary and secondary, I mean it's not the one that is the most distressing to people.
mhm, mhm.
Um, Oftentimes it is. Oftentimes that is the most distressing one. Sometimes people will come to us with back pain, but also vertigo that comes and goes
Right,
as well, which is
right.
distressing to them. But at the current moment, their back pain is
It's the
bothering
back
them.
pain that's the big one.
So,
Yeah.
but we see that all the time. We see it as a primary symptom quite often.
Yeah, and well, and likewise for me, of course, the primary symptom is
Of
always
course,
dizziness,
of course, yeah,
but I have yet to meet a single person who didn't have some other symptom.
Yeah.
So
It's
either
really
in the
rare.
past or now, yeah, they've often got pain, they've got tension, they've got,
Yeah.
numbness, they've got tingling, they've got palpitations, and they're like, "Oh, all this came on at the same time. The dizziness is causing this." And
Right.
I try to,
Totally.
and so they'll ask me about exercises for these various
Mhm.
parts of their body. So, what as an aside, what do you think about that? Again, as from your perspective, do people need to be doing like neck exercises or back exercises for their pain when they're
Or for
experiencing that stuff?
dizziness.
Mhm,
So one of the kind of when I'm training clinicians or talking to doctors about this, I talk about
mhm,
behavioral things that we can do to help our symptoms,
mhm.
and those kinds of exercises can be good as long as we are not thinking that those exercises are in and of themselves the fixing the problem, if that makes
Mhm.
sense.
Mhm.
A lot of the exercise stuff that, from my perspective, that I would encourage is about exposure.
Yes, 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 yes. That's
Is
how I
about
talk about VRT. Yes.
Yes, yeah,
Yes.
exactly. It's about exposure and helping to retrain our brain that
Mhm,
doing these motions or sitting and standing or going for a
mhm.
drive or what have you, proving to our brain that that's all safe again,
Exactly.
that we can do that. So
Exactly.
that stuff is important. We just don't want to think of those exercises as the be all end all
Mhm,
for fixing it.
mhm.
It's just, but it's an important part of it. We talk about behavioral stuff for people to do all the time with our work.
Right, right. Okay. So you do so it's not anti, but it's not being used to fix. You don't view these as as physical abnormalities, like there you have some kind of neck problem that needs to be attended to by some kind
Right.
of professional, or you have to do these special rehab exercises. It's a manifestation of this same
Yes.
exact set of things that we've been talking about this whole time. But sometimes doing things with that part of your body can be helpful for exposure purposes to teach your brain that it's safe to do that
You said it.
movement
You
or
said it way better than I did. So thank you.
no,
Yeah,
I'm just
that's great.
people need to hear it in a few different ways.
No,
So,
you're
right?
right. It was just
Helpful.
beautifully said. Totally. That's exactly what I think. And we see this a lot. We do, as I said, we do a lot of behavioral stuff, especially with dizziness. So,
Mhm. Well, and
yeah.
that raises another question for me. So, do you think of dizziness any differently from how you think about pain?
Uh, I can confidently say, been in the field for a little while now, that no, I don't.
Mhm.
However, I recognize that however a symptom is manifesting, however our brain is manifesting these symptoms in our lives, influences the way that we behave differently. If you have dizziness, differently than somebody who's got migraines or somebody who's got back pain.
Mhm.
It's going to manifest differently. So so I'm very, very sensitive to that, and that
Mhm.
the symptom has kind of altered our lives and maybe
A
feels like it's
different
like
way.
robbed some
Yeah.
things from us in a different
Yeah.
way.
Yeah.
So I'm very sensitive to that. However, the treatment path is very similar.
It's the same.
It's very much
Mhm.
the same. Yeah, exactly. So the exposure behaviors might be a little bit different based
Mhm.
on what the symptom is, but otherwise the emotional treatment path and even the cognitive part of that is the same.
It's the same. Okay.
Yeah,
So now I'm gonna throw you a little bit of a curveball because I didn't tell you this
please
question was
do.
coming. All right.
You make it
So
tough. Here we go.
all right, here we go. So speaking of unique dizziness experiences, so
Uh-huh.
some of the viewers, a lot of the viewers of my channel have unusual, strange combinations of symptoms
Yep.
associated with something called triple PD, as I know you're familiar with.
Yep.
A subset of them have something that they've been diagnosed with that's called MdDS or mal de Debarquement syndrome, which
Which
is
I've heard of, but to be honest, I'm not super familiar with. So
I'll
you can
explain.
educate me here. Yeah.
Yeah, you are familiar, you just don't know this particular
I'm
name
sure.
has been
I hear new
attached to it.
diagnoses every day, to be
Yeah.
honest. So
So
yeah.
they just attach this particular diagnosis to it, but it's basically a sensation of rocking or swaying all the
Uh-huh.
time.
Oh yeah, I'm very
24/7
familiar.
bother. Yes, I knew you would be. I knew
Yeah.
it just has well, here's the thing. So with triple PD, not to say that the information on the internet is sunshine and roses or anything, and people go on the Facebook groups and get the daylight scared out of them, but
Of course.
it seems that they come with less of a gloomy outlook than people who have this particular MdDS diagnosis attached to them. And again, I've seen people who have those symptoms who get the triple PD label, and then I've seen people with
Of
the
course.
tr- with an MdDS label or with MdDS
Or with
symptoms get
symptoms,
triple
but
PD
getting
or yeah, they
yeah, yeah.
get it's
They
they're
get
as
mixed
far
up.
as I'm concerned, they're interchangeable.
Right.
So I'm curious to know this just again for those folks watching who have 24/7 symptoms that don't seem to change.
Mhm.
So they don't one of the things we tell people to do, and I'm sure you do too, is watch for the weird fluctuations you have in your
Of course.
symptoms, because
Mhm.
often you will see this relationship to stress or emotions. But some people report to me that their symptoms are
We don't see it
just
at all.
miserable 24/7, no change at all.
Right.
So, how, first of all, have you encountered people like this who just have constant
I can
symptoms?
Yes, period. Absolutely. We see a lot of people
Yes.
like that actually. So
Wonderful. Not wonderful, but
yeah,
that's wonderful to hear.
it's
And
familiar. Yeah.
can they get better?
Yes, I don't. Yes, they absolutely can get better. It
Mhm,
might be a little bit trickier starting up
mhm.
to kind of uh, gather the evidence and the information that we need about their particular symptoms.
Right,
But we,
because it doesn't seem to be as obvious
Mhm.
sometimes, right?
Yeah,
Like,
yeah,
when
exactly.
someone says, "Yeah, yeah, things got really bad the other day when my boss yelled at me." Well, okay. I mean, that
Right.
tells us a lot about what's going on
Of
inside
course.
you, right?
Then it's very clear. Yeah.
Yeah. So what would be your starting point with a client like that? Just, I know that's a very difficult question to answer, but someone who has 24/7 symptoms, they come in, they say, "Daniel, my symptoms don't change. They're at a 10 out of 10 all the time, and I'm completely incapacitated. I'm in bed all the time."
First of all, I'd have a lot of empathy for them because being in bed all the time is rough. I've worked with plenty of people that have been in bed for years, and it's a very painful experience. The First, I would normalize that for them, that it is not uncommon for people to come in and say, "Nope, my symptoms are exactly the same," whether we're talking about MdDS or, which again, thank you for educating me on that. But that symptom I've worked a lot with before. I think
Mhm.
I haven't heard that diagnosis before, or if I have, I have, but I
It's
don't.
growing. It's just
Yeah, that's
catching on,
I saw it.
unfortunately.
Well, I saw it in a
Yeah.
post that somebody was. That's anyway. Um,
Yeah.
Whether it be that, or we have people that show up with back pain, for example, which is a common one. They say, "Nope, my back pain's 100% the same all the time, no matter what happens."
Mhm.
And okay, then let's take the pressure off of trying to find variations, because actually trying to find putting the pressure on to find variations can only make us more frustrated,
Right.
and it can kind of spiral us out if we're like, "Nope, I'm the
Mhm.
only one that can't do this." Because
Mhm.
what happens oftentimes with people that are in a constant state is that they are in a very disempowered emotional state.
Oh, huge. That's the big issue. And then they
Ex-
go online, and this particular group of people, they're particularly disempowered because of the messaging around it. It's awful. So yeah,
Mhm.
that's the place they're coming from.
And it's a feedback loop, so
It
that
is.
the messaging that they get is disempowering, so then they feel more disempowered, and they
Mhm.
themselves, no fault of their own, also spread messages of disempowerment, and
Mhm.
it keeps going. And we see this with a handful of diagnoses. There's another couple that are, if you Google them, it's just, it's the worst thing ever that you can imagine on there, and
Mhm.
just terrible. So we, of course, don't encourage people to Google anything. Don't be your own doctor. It's a terrible idea. Um, but yeah, so we want to. What I would look for is where they are disempowered in their life, and I'd say, you know what, this is where ACT stuff can come into play a little bit at
Yes.
first. Not that
Yes.
we're accepting that the symptom will never go away, but we're going to accept where it's at right in this moment.
Right.
We're going to accept right where it is, right where you are. We're going to accept that, and we're going to do everything else that we can to
Mhm.
improve our lives and see what
Mhm.
happens.
Mhm.
So that's what I would say. Like, let's take the pressure off of finding those variations, because that can kind of feel defeating and make us feel like I'm only different. I'm more different than everybody else in this way too. So
Mhm.
let's find other ways. And as I said, most of the time when people are in a place of like steady pain and they see no variations, they are some of the more disempowered clients that we
Yeah.
see.
Yes,
So
yes, and like you're saying, and it's very interesting that there's this, almost this culture, a subculture around each of these diagnostic labels when they're all symptom-based diagnoses anyway, with no clear
yes,
demarcations a lot of
yes,
the
they're
time.
all symptom-based
They're all
diagnoses, which drives me
symptom-based.
insane. I'm like, this
Eh,
is not actually describing anything
right,
wrong. It's just describing symptoms here. It's
right,
not like
right. I've had it's crazy because I have clients who will get referred to me by a particular neurologist who's fantastic, and the way he
yeah,
talks to them is like, so he doesn't really, he'll give them the name, he'll say, "Yep, it's triple PD, but this is what this means. It means
yes,
your
good,
nervous system's just, more sensitive to movement than normal, and this is
good,
workable," and that changes
yes.
everything, whereas these
Mhm.
people come to me when the doctor's like, "I don't know, this probably sounds like MDDS, it's incurable, you're gonna have to live like this forever." There's so much there's so much damage
Oh,
done
it can
from
take
that.
months,
It takes months.
years to get over
Yeah,
that
yeah,
damage that's been done.
yeah,
Yeah.
yeah, but it
Which
can be done. That's what you're
Yes,
saying.
absolutely. No, I'm very
Mhm,
confident, like, that's why I tell people, don't we can't take that word and hold on to it too tightly,
mhm.
because that's just
It's a
listen, we're
symptom-based diagnosis.
yes, and symptom-based diagnosis don't prove anything to anybody. It just
Right,
says, "This is what we're seeing right now. This is what we're
right.
experiencing with the symptom," and it doesn't mean anything.
Right.
So,
Right.
you
And
know,
for the record, that I see the same thing. It doesn't matter. Again, the damage, as we've just talked about, when people come to me with that particular diagnostic label, sometimes they're so anxious because of what they've been told that it takes time to get through that.
yeah.
But
Which I don't
but
mean to scare anybody by
right,
saying that.
right,
So I don't
right.
mean to scare anybody by
No, of
saying that at all.
course.
That's not. There's. I didn't mean to cut you off. Sorry, Yoni.
No,
Go for it.
go ahead. Yeah.
That's just like what I tell people all the time, and this is such a truism, that the only constant in this world is change.
Mhm,
There is nothing that stays the same.
mhm,
Literally nothing that stays the same. And that is true for us and our bodies and our minds and our symptoms.
mhm.
So it is inevitable things will change.
Yes.
It's guaranteed.
It is. It is. It is. And so I you can get out of this. You
Oh
can get
yeah,
out of this. And I see
totally.
the same thing that you mentioned. Just
And you
yeah.
can get out of it pretty quickly too. That's the other thing I like about this work. Not always. Some
Not
people it takes
always.
some
Mhm,
time and you got to work at it for a while, which so be it.
mhm.
But for some people, they can actually get out of symptoms pretty quickly. And from a clinical perspective, pretty quickly, I would say is like less than 6 months,
Right.
because that's
They
we're not miracle
do.
workers here. But
They
yeah, like that's
do.
yeah,
Yes, they do. Sometimes not. Sometimes there's stuff. We gotta work through stuff.
yeah. It takes longer. That's okay too. But it
Mhm.
just there is always hope. There's always hope.
There is always hope. There's always hope,
Yeah.
and and I tell people I know it doesn't feel like something worth celebrating when you get a symptom-based diagnosis, but it's
Yeah.
fantastic news because it means you already have all the tools you need to get better. It's just a
Yes.
matter of figuring out how to implement them, and sometimes it's as simple as journaling or, just understanding the mechanism, and sometimes people need more help. So
Yeah.
at what point do you feel like someone should look at one-on-one therapy or coaching?
Um, I think that if you're new to this world and you're new to this understanding of how to treat things, it's important to do some research,
Mhm,
read some books.
mhm,
The handful of books that I'd encourage, and Alan Gordon's The Way Out is great, easy read, it's very simple
mhm.
language, which is really helpful. Howard Schubner's Unlearn Your Pain, I think,
I
is
love that
one of the
one.
best ones. Yeah, it's great.
Mhm.
And even the old school book, um, uh, oh my gosh, Sarno's Mind Body Prescription,
I love that one
I
too.
think is a great one. And that's I usually encourage, like, if you're looking for books to read, those three are great kind of foundational ones to understand this a little
Mhm.
bit more and really see where you're at that point. If you read those books, it's been a month or so, and you've kind of done some work through the Unlearn Your Pain book, and you're feeling kind of stuck. Totally appropriate to reach out to somebody and get some extra help. It
Mhm.
never really hurts to get some extra help, so
Yeah,
I think it's a really healthy thing to want to say, hey, can you kind of guide me through this process? But
right.
also, I get it. One-on-one help can be expensive, or in this country especially. So those books are out there to help you, and they're not expensive. You can afford
They're
them.
not.
They're accessible. So tell people
Mhm.
start there, and then if things really don't feel like they're moving along, then seek out help.
Right.
Would you agree with that on your experience?
Yeah, yeah, yeah. I
Yeah,
mean, I always want people to take the course. I mean, I have that free course,
of
which is
course,
basically a
of course.
translation of the
Which so
books
many of
in
our
my own
clients have
experience.
used. So
Awesome. So
yeah,
glad to hear that.
yeah,
It just helps people realize, like, this is your therapist is right. You know?
yeah.
Listen to Daniel. He's right. I'm corroborating everything he's saying. And then there's some dizziness specific nuances that help people
Of course,
really feel seen. And there are I mean, again, some nuances there, but I think that we're also going to be better able to help you once you know some of the material. But some
absolutely.
of you folks, you wonderful, wonderful analytical folks, th- will go so far down the information rabbit hole that you don't know how to implement. And
Yes.
that's where it can be really helpful to get help too.
And most of the time, we can't think our way out of this. We
We
have to
can
feel
think
our
your
way
way
out
out
of
of it.
it. And
Yeah.
for some people, that's very difficult to feel our way
Mhm.
out of it for a lot of reasons. We've been, conditioned that feeling is dangerous, so we think our
Mhm.
way out. I joke in this population that we work with, and I love the population that I work with, but also I'll suggest they read a book by one author, and then they'll come back next week having read all the books by that author. So I
Right.
just wanted to read more so
With
that I'm
highlighted
educated.
and they've
Yes,
highlighted,
exactly,
and they'll write you a
exactly.
detailed, like, summary with
Yeah.
annotations and
Oh,
a
I've had stacks
bibliography.
of papers that they've handed over to, which is great, like book reports, what have you. But it is a very analytical population. It tends to be pretty analytical, and so
Mhm.
we want to encourage them to feel more, not think your way out of the
Right.
problem.
Right, and
So
so that's something that people can do for themselves too. So,
yeah,
if people ask, "Do I have to journal?" No, you don't have to journal to get
yeah,
better. That's just one particular way of
a
of
tool.
helping yourself.
Yeah,
It's a tool, but the non-negotiable in my opinion, is feeling.
Oh yeah.
There has to be some connection to the feelings, and it's not always all centered around, oh, my deep repressed
No,
emotions. It's not
no,
all always that, but some willingness to accept. There's an acceptance component of being able to be with the
yes,
discomfort without trying to push it away. There's some component of that
exactly.
that also applies to our emotions. There has to be some willingness to be with those feelings without trying to push them away, like you were saying earlier.
Totally. I think I'm just reminded right now of that Jennifer Aniston movie Cake. Did you ever see that?
No.
It's oversimplifies the process a lot, but it's this woman who's struggling with pain, and then she, near the end of the movie, and I won't ruin it for anybody, but she has an emotional experience and things change for her. So
Oh,
I recommend that for people. It's a
I should recommend that to people. I'm always
Yeah.
recommending Inside Out. I
Oh
recommend
yeah.
that
I
movie
mean,
all the
Inside Out
time.
is just like I mean, gosh, that
Yeah.
movie makes me, when Bing Bong dies, I cry every time.
I
Oh
know.
man, I
I know.
can't
I
every
know.
time.
I
I was
know.
watching it with my nephews, and they were like, "Oh, that's sad," and I'm over here like just bawling, like Bing Bong.
I know.
So
I know. I know. I
anyway,
know. There's so much, especially are you a parent, Daniel? Remind me.
I am not, no, but I
Right.
have I'm very close with my nieces and nephews, and
Right.
I
So you
understand as a parent
understand.
it'd just be
Yes.
so, yeah,
Like you say,
yeah.
your nieces and nephews growing up, and you can kind of
Oh
see
gosh.
this reflected in that too. Oh my gosh, I know it's
I think if I was a parent, I'd cry 10 times harder,
yeah,
which would be even more out there. So,
yeah,
but yeah,
yeah.
Cake by Jennifer, or with Jennifer Aniston, is a
Mhm.
great opportunity for people to kind of understand a little bit of the mind body connection. It's a heavier
Yeah.
movie, but it's very good.
Okay.
So,
Yeah. So
yeah.
watch that, guys, if you haven't seen that either.
Yeah.
Okay. So if people need help, how can they find you? On your
Well, I
website?
was
Is
going to,
that the best way?
my first response, if people need help, I was like, you are such a great resource. So I hope people
Oh,
are relying
they're
on you, because
they're
you
they're
are a very
finding
great
me.
resource. So, yes, it's great.
Yes, they're finding me. But
But if they want to reach out,
yeah.
yeah, our website is mindbodytherapycenter.org.
Mhm.
Again, mindbodytherapycenter.org. You can check out our information on there, and we have a contact page. You can just send us an
Mhm.
email about whatever's going on. Even if you're just having questions, just curious, just send us
Mhm.
just send an email. I'm happy to talk things through. So
Yeah. Well, and it's just again, guys, regardless of who you're reaching out to or what help you're
yeah,
needing, I I am not just some random lady on YouTube who came up with this stuff and I'm like
right.
the only one.
Yes,
I'm like some wacko,
you are not alone.
not,
No,
not. And I needed to hear that from you several times. So that's why I email you every so often. Am I crazy? No, I
yeah,
haven't done that in a while, um,
no,
but, but the point is, so someone here, Daniel, with 10 years of experience or more than 10 years of experience now has seen this and seen people recover
all the time.
regularly.
Yep.
I'm seeing people recovering regularly. You can recover. You can
Yes,
recover.
absolutely. There is always hope. Yeah,
Yes.
truly, and
Awesome.
that's something that is important to embody, internalize for all of us.
Mhm.
That there's hope. So,
Yes. Amen. So I
yeah.
guess that's probably a good note to end on, but I wanted to ask if there's anything else, any other advice you wanted to share or anything else you want people with dizziness to know before we finish.
Um, you know, these days I'm really leaning into I found in my career, I've kind of gone through different spaces that I am excited by, or kind of like
Mhm.
playing with a little bit. And these days, I'm really leaning into finding levity even in the darkest spaces. So keep a humor journal. Watch movies that make you laugh, even if you don't have, even if it doesn't feel like there's anything that's making you joyful at all right now.
Mhm.
Find ways to lean into joy, is what I'm saying. Even if it's a fleeting little bit of it in the depths of your darkest moments, just see what we can do to laugh, even if it's laughing at the darkness, even
Mm.
if it's laughing at how dark we are. I think it's really important. Life is too short to not be able to at least laugh at some stuff. And I know that's hard to believe when you're really, really, really in pain, or really, hard to get out of bed because of the dizziness. Just um, do what you can to bring some
Mhm.
levity to your life.
Oh, that's such great advice and something I really haven't talked about on my channel very much. So that is beautiful. Great way to leave us for the day. So thank you. Thank you,
Of
Daniel.
course.
Thank you so much for agreeing to do this.
Oh, my
And
pleasure.
if people have questions or comments, of course, you guys can drop them below in the comments. And if there are questions specifically for Daniel, I'll pass them on to him.
Yep.
So again,
Yeah.
feel free to just comment.
You can also email me directly if you want, which is
Mhm.
info@mindbodytherapycenter.org. So if there are questions specifically for me that you can just email me directly if you want, or otherwise talk to Yonit, and then we can talk it through.
Wonderful. Thank you so
Cool.
much. Thank
Of
you.
course.
All
Thank you.
right. All right. Well, I'll talk to you soon. Thank you guys for tuning in. And if you enjoyed the video, please like the video, please share the video, and subscribe to my channel. We'll talk to you guys soon. Bye.
Have a good
Bye,
one.
Daniel. Thank you.
Bye-bye.